A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, welcomes all the speakers and the viewers who have joined in for a panel discussion. Voice of Healthcare, along with our powered by partner Manipal Hospitals, has taken an initiative to bring together the experts and speakers to discuss on elevating surgical excellence with robotic surgery. Today, we gather to explore the transformative role of robotic surgery in advancing the field of medicine and its potential to revolutionize surgical procedures. In recent years, we have witnessed remarkable advancements in robotic technology, enabling surgeons to perform complex operations with enhanced precision, improved dexterity, and reduced invasiveness. Our esteemed panelists, who are pioneers in the field of robotic surgery, will share their experiences, expertise, and insights into this rapidly evolving discipline. So, without further ado, let's get started with the introduction of our esteemed panelist. I welcome Dr. Rajashekhar C. Jaka, consultant surgical oncology and robotic surgery, Manipal Hospital, Whitefield. Welcome, Dr. Jaka.
Sir, you are muted. Mute.
Hi, thank you so much.
Dr. Manjunath Haridas, consultant general laparoscopic, colorectal, and minimal access surgery, Manipal Hospital, Whitefield. Welcome, Dr. Haridas.
Thank you very much. Nice to be here.
Dr. Deepak Jayaprakash Kaddu, consultant urology and robotic renal transplantation, Manipal Hospital, Whitefield. Welcome, Dr. Jayaprakash.
Thank you, Ritika.
Dr.
Thank you,
Sumit
everyone.
Talwar, consultant general laparoscopic and minimal access surgery, bariatric surgery, Manipal Hospital, Whitefield. Welcome, Dr. Talwar.
Thank you, Dr. Ritika. It's a pleasure to be here.
So, starting with this discussion, I would like to put forward to all the speakers, starting with Dr. Manjunath, how has the integration of robotics transformed healthcare over the last 10 years? And how do you envision the future of robotics in healthcare?
Thank you very much for having me here today. This is a very important question to start off with. I mean, before I actually start entering into the question, I think there are a couple of important points that we should consider before even getting into what robotics has done for surgery. Now, if you look at the total landscape, the laparoscopic surgeries are almost closer to 14 to 13 million surgeries per year in the worldwide. If you break that number down to Indian population, I mean, we are one of the world's highest populated place in the world, and we perform closer to around 3,000 to 4,000 surgeries per 1 lakh population. That is probably a little bit lesser in number. Now, if you actually break that number down even more, I mean, robotics is just probably around 20,000 surgeries per year, and this is coming from the last year's data itself. So, if you look at really the laparoscopic surgery at the initial introduction in the 1980s, it changed the landmark about laparoscopic surgeries performed. It changed the way that we look at diseases, it changed the way we treat diseases, and ultimately the patient outcome became far better from the conventional surgery. So, I think in robotic surgery itself, in terms of what we are looking for, in terms of patient outcomes, things are starting to change with the introduction of robotic surgery in the 2000, probably around the 2000 by the Da Vinci themselves. I think the number of surgeries that have been performed started to increase in the urology and the surgical oncology section. And slowly we started to realize that patients are far superiorly getting better in terms of their outcome, in terms of their recovery, and the disease as well was better controlled. And if you look at the laparoscopic surgeries, compared to the robotic surgeries, robotic surgery was able to give one upper hand more than what the laparoscopic surgeries would do for robotic surgery would do for the patient's recovery. And this has improved significantly in the patient outcome. And I think we have almost closer to a decade or more than a decade of experience using robotic surgery in treating patients. And I think right now the expert would be towards robotic surgery themselves. I think that is where we should actually look at trying to improve and enhance robotic surgeries in the near coming future.
Right. Thank you so much, Dr. Manjunath. Moving on to Dr. Deepak, sir.
So I would like to, yeah, as sir has spoken, so world is slowly moving towards from laparoscopy to robotic and making it more and more minimal invasive and more patient and doctor comfort. So this how the robotic is improving and how it is revolutionizing the healthcare in India. So if you take the number of surgeries happening in USA, so in the minimal invasive section, like compared to the laparoscopic robotic, so more number of surgeries they are doing by robotic, and the laparoscopy number is less because the patient awareness is more. They have a lot of insurance coverage for the healthcare, so it is very easy to get to robot, and most of the hospitals having the robot, the maintenance is for them. It is easier to maintain with whatever healthcare they facilities they have got. So it will slowly the trend in India will also change. So I was discussing with one of the robotic companies, their people, the engineers. So they were telling that what they were selling in 1 year, like 2 3 years back, the products they were selling, robot where they're selling, they are selling almost 5 to 10 times in 1 quarter. So this is how the revolution is happening. So we are getting more and more robots in our health system, and slowly, once the health insurance coverage becomes more and more widespread, and the people are accessible to health insurance, they will not care whether laparoscopy is less expensive and robotic is more expensive because insurance is covering it. So they will go for the best treatment available, which is the robotic. So in the minimal invasive section, definitely the robotic is going to revolutionize. And also, uh, if you take like in the recent perspective, many of the surgeons, like in when I finished my MCH, it was like almost I have done many things, and the robot was I have not learned robot, but after some time, after in being in private practice, I got the training of robot. But now the even the older generation of surgeons, they are dying to learn the robot because they know the future is robot, and learning a robot is almost like a must training. It is thought like in subspecialty that robot is an subspecialty, but here onwards I think you need to have a robotic training as an additional training, because you might encounter any difficulty. You need to have the robotic access, and you should have robotic knowledge while operating the patients. And of course, if the doc because robot has the best vision, the best dexterity, and the surgeon is at very much comfort. So if the surgeon is at very much comfort, the results are of course at the superior level, and the learning curve is so less as compared to the laparoscopy. And the more and more people are learning in very fast, the trend, and soon India will be leading in robotic surgeries, whether it is in number or in quality. I think so. Yeah.
Right. Thank you so much, Dr. Deepak. Moving on to Dr. Rajashekhar, sir.
Yeah, I think most of the points are already enumerated. I would say with only one sentence that it is the future. Robot is going to be the future technology through which we are going to do surgeries, majority of the surgeries. Though we have begun with few surgeries, mostly in future, majority will be done by robot. Uh, as simple because patient care is better, so surgeon comfort is better, so surgery is performed in a better way. So definitely this is the future, which has really made lot of difference in the outcome of patient care. And cost wise, yes, it's a new technology, very standard technology, so that is why now cost is high, but over a period of time it is going to become very less. And every small hospital setup, small nursing home will have robo in future. So I would say just one word, that it is the future of surgery. That's all. Thank you.
Thank you so much, Dr. Rajashekhar. Moving on to Dr. Talwar, sir. We would like to add something to that.
Dr. Rajashekhar Jaka just stole my lines. So, so I believe everything has been covered. Just reiterating a couple of things. One is that I remember when laparoscopy was introduced, it was also met with the same skepticism as the robot is being met with even today and a long time back. The cost of laparoscopy has gone down tremendously, and the laparoscopic equipment is now available in all OTs. If you want me to say it like that, it is available in all OTs, and ultimately, I see in about 10 years that in all big hospitals, all OTs will have robots. Um, in smaller hospitals, in another 10 years, everywhere the robot will be available, and everything that we are doing laparoscopically, well, not everything, but quite a few things that we are doing laparoscopically will be shifting over to the robot. Whatever we could do open, we have done everything laparoscopically, and of course, shifting over to the robot is like a piece of cake, and it is even simpler and better. So that is how it is going to be.
Thank you so much, Dr. Talwar. I think all the speakers have rightly said that once we transformed from open surgeries to lab surgeries easily, so I think it will also be the future of healthcare surgeries, basically the surgeries that we do on patients. So we have moved from open to lab, and now we are moving from lab surgeries to robotic surgeries. So yeah, so that is what I'll take from all the speakers what just said. And now moving on to Dr. Manjunath, sir, can you please share examples of some challenging GI surgeries where robotic assistant has been particularly beneficial? And how does robotics contribute to improved patient outcomes and reduced complication rates or more efficient surgical procedures?
When very recently, I can actually quote two examples where I really thought that if I had the robot, it would have been very helpful. Now, one was just yesterday, I did a total gastrectomy, and I can tell you, just off the back of the experience, initially when I had done gastrectomy with robotic surgery, it was a breeze, and it would take some time, but was able to complete it within normal limits. And the anastomosis was not that difficult as well. I mean, if you had any problems with any kind of a stapling device or anything at all, you could just go ahead and sew it. I mean, that is how instinctively you can just make decisions and you can go ahead and change the patient outcome. Now, yesterday's laparoscopic total gastrectomy had to be done because of patient financial issues. But the amount of stress and the amount of difficulty that I had to go through trying to make sure that the outcome is better, and ultimately we didn't have a stapling device that could have been potentially done a good staple of the remnant of the esophagus and the jejunum was not there, and we had to improvise a little bit different kind of an anastomosis that may have compromised. I hope it doesn't, but at the end of the day, it makes you a little bit uncomfortable because you really want to do the best that is possible for every patient outcome. The robotic surgery gives you those options, and this is just one example. I mean, just 2 weeks back, I did a very large complex hernia on a very young woman, and she I dreaded trying to get things back with laparoscopic surgery. If I had that robotic with me, and if she had agreed for the robotic surgery at that time, and I can still say that that patient outcome would have been far better than what it would have been now. So these are just few examples where you can really bring it down and say, you know what, I wish I had that. And I think at Manipal, Whitefield right now, we should shy away from saying that I wish I had that. And I would like to make all the patients who are actually watching this, make them aware that, you know what, if maybe if you have any problem that needs to be addressed, and if you think you can find any kind of a surgery, what I would recommend them is choose robotic surgery. I mean, we are there and we have the top-notch robot in our facility, and you should probably look at trying to get a better outcome by using those facilities that are available. And these are just few examples. I'm pretty much sure each one of us have examples of such over a period of decade where we can just keep on going and we will not even have time to finish this. But I think these recent two examples really pinched me, saying that I wish I could have convinced the patient a little bit more and would have given them a better outcome. So these are my 2 cents about how robotic surgery I could have used in the recent past.
Thank you so much, Dr. Manjunath. I would like to congratulate Manipal for taking a leap ahead, a step further into the robotic surgery. And thank you so much for sharing your experiences with the surgeries that you have done with the help of robotics and the GI surgeries, basically. And moving on to Dr. Rajashekhar. So, sir, we talked about GI surgeries. So, what do you think are the specific challenges and complexities involved with cancer, and how does the robotic approach address these challenges?
See, as such, the advantage of minimally invasive surgery, what we say, that is definitely there with the robot. Beyond that is the precision. What we have a bigger advantage in this because as far as onco is concerned, means cancer is concerned, the margin status and also preserving the or reducing the collateral damage is also very important because, for example, in case of cancer of the rectum, it is as important to preserve the sphincter, also to preserve the nerves so that side effects are less. So I would say the when you have to dissect in the planes, the right planes, only then you will be able to get a negative margin, and also tumor chances of tumor coming back becomes less. Otherwise, anyone can resect a tumor, but if it is dissected in a proper plane and if negative margin is achieved, then chances of it coming back becomes less. So patient can survive for a longer time. So that is how it is. Like negative planes of dissection are good. Deeper into the pelvis, sometimes it is very difficult to see through the laparoscope. And similarly in thorax, it is so difficult to manipulate because of the cavity structure is like that, that we will not be able to bend the instrument so much. So in the robo, we don't have that problem because it's an endo-rich technology. We will be able to access any part of the thorax with this. So like this, there are a lot of advantages. And sometimes in the rectum, intersphincter dissection or tumor is very close to the sphincter, even then we will be able to go near the pelvic diaphragm and do it. So all these things are possible. So in that way, it gives a better outcome. Surgeon will have a better comfort to dissect in a complicated area, and also can give a better outcome to the patient. In this way, definitely it is a lot better.
Rightly said, Dr. Rajshekhar. We need precisions so that cancer don't reoccur. So thank you so much for giving those insights. Moving on to Dr. Deepak, sir, what are the key benefits that patient experience with robotic surgery as compared to the other surgical open and lab procedures, and how it enhances patient safety, minimize complication, or improve post-operative recovery?
Yeah, so I would like to give my urology perspective in this, how the it is safer for patient and better outcomes for the patients. So the most commonly done surgery is radical prostatectomy in urology by the robot. So in robotic assisted radical prostatectomy, we are operating in a pelvic cavity, which is a very narrow cavity. So to reach that cavity, the laparoscope is very difficult. Means we can reach, but the anastomosis and the assistant part becomes very difficult. The suturing becomes difficult. But if you go for the open, it's the going the hands there and doing the suturing is another difficult level. So for robotic, it's quite easy. You can reach your camera wherever you want, and a surgeon can shift his camera on his own. And the suturing, the dexterity is so excellent. The suturing becomes very easy. And as Rajashekhar Jaka sir told, you can see the minute structures, so you can preserve the nerves and you can preserve the minute vessels which could have been damaged if you do by laparoscopy or open, and that can cause bleeding and complications. So you can definitely save the patient from complications. You can give better results because you are preserving the nerve. So the continence in a post-RRP patient is excellent, and as the suturing is good, so the urine flow is also good, and the erection is also good because the nerves are preserved. And the most important thing, the oncological safety margins. as you are removing the tumor in entirety with the robotic excellent vision, you are giving the best oncological result. So another surgeries we do is robotic partial nephrectomy, which is most of the things are possible by robotic. People do by laparoscopy, but it's very easier to do by robotic. And again, the oncological safety margin, preventing the complications like urine leak or pseudoaneurysm or bleeding. So there are some other surgeries which are not looked into by robotic. I would like to give example is we do video endoscopic inguinal lymph node dissection. Previously, people used to do by open, and in which you create a flap, and then the patient. This is in terms of CA penis having the groin lymph node. So the patient keeps the drain for longer time. But when you do the dissection with the robotic method with the wheel, the patient just the drain is removed on the fourth or fifth day. And even in terms of robotic assisted IVC thrombectomy, we have to make around 30, 30 centimeter wide incision to take a better vascular control when we are operating a renal cancer with the IVC thrombus. But when you do by robot, you can easily, with the minimal access, you can prevent the larger incision. So the patient suffering is decreased. So the patient can recover from a major surgery quite fast. This robotic assisted IVC thrombectomy, if you do by open method, the patient might succumb to the big incision and the comorbidities related to it. So these are some of the urological surgeries we do by robotic. So one thing is the dexterity, because the suturing is very clear because of the dexterity, then the excellent vision and the assistant, you need not depend on anyone else. The doctor himself can move the camera and the assistant ports. And the most important thing I would like to speak again, that if you are driving to some place, if your driver is at the most comfort, that is your surgeon is at most comfort, then your journey will be excellent. Like you will reach the destination fast and safe way. So the surgery will be the best. So the outcomes will be the best if the surgeon is at comfort. So the patient benefits will be earlier recovery and lesser complications, as I mentioned, and the cosmesis and the pain is less. All those with the minimal access surgery. So these are the doctor and patient benefits from urology point of view for the robot. Thank you.
Thank you so much, Dr. Deepak. I think you have told us about most of the important surgeries that are done in urology and the benefits of it for the patient as well as the doctor. It also, I think, reduces the physician burnout and the long surgery hours as well. And yeah, so moving on to Dr. Sumit. So we have talked about GI surgeries, urologic surgeries, cancer. What specific advantage does robotic surgery offer in bariatric procedures? And how does it enhance patient outcomes as compared to the lab techniques that we are currently doing?
So here we are talking about patients who are 2 or 3 times the normal body weight. So their abdominal wall, the amount of fat under the skin and is so huge that when we operate with laparoscopic instruments, there is a lot of torque that comes to my hands and to my shoulders. So as a result, what happens is that the dexterity that I need at the end of my instruments is reduced. Second thing is the abdominal wall is so heavy that the insufflation pressures have to be kept high, and that in turn leads to a lot of problems in the patient circulation and maintenance of the blood pressure and all. So when we are using the robot to perform a bariatric surgery, which is a complex GI operation being done in a relatively small constricted space, we use two of its uh, important attributes. One is that since the instruments have an endorest movement and they can move in various directions, we can reach difficult corners with robotic instruments, in which we have to struggle when we are doing when I'm using a laparoscope. The second thing that we as bariatric surgeons use most often is something which is called a robo lift. The robotic arm is used to lift the abdominal wall. and stabilize it there. That is one of the attributes of the robot that we use. So since we can lift the abdominal wall and stabilize it there, it doesn't transmit the burden to my shoulders. I can use that position for a longer period of time. We get more space to work inside, and we can do a better job inside. Whenever we cut and staple or sew the gut, there can always be complications. But if we do a good job in the first place, when I'm not tired, when I'm doing it in the best possible conditions, I am assured of the best outcomes for my patients. So, although from the outside, the robotic procedures might seem longer than laparoscopic surgeries, what I want to say is that the more difficult the surgery becomes, the better the robot performs. So what I say is that the robot shines in the most difficult of the surgeries. So these are the most difficult of all patients, and we are doing complex GI surgeries in extremely heavy and extremely obese patients. So the robot obviously shines there.
Rightly said, Dr. Talwar. I think you have given an excellent insights on how robotics helps in bariatric surgeries. And moving on to the second part of this discussion, would like to ask Dr. Rajashekhar. You discussed about the role of benefits of robotic surgeries in cancer. So, what different type of cancers can be managed through robotic surgeries, and what is the potential prognosis in these type of cancers?
See, as such, there are many types of cancers which can be managed with the robotic surgery. Right from, we can say, head and neck. We have oropharynx, we have hypopharynx, which are deeper lesions, BOT lesions, we say base of the tongue lesions. All these days, it was so difficult to access those areas. So always we used to give radiotherapy. And post radiotherapy, if there is a recurrence, it was so difficult to access them because we had to cut open the whole mandible, whole mouth at one side and go inside and resect a small lesion. But now with the advent of this TORS, what you call transoral robotic surgery, we are able to remove the primary if it is very small, so you don't require a radiotherapy at all. Or if there is a post RT recurrence also, then without damaging any surrounding structures, we will be able to go inside and do that. Apart from that, there is a thyroid surgery because young girls are more concerned about the scar in their neck. Then we have a different approaches, scarless approaches, or scar will not be visible. Somewhere else we will be taking an incision and going there and doing it. In this way, in head and neck, it has made a difference where previously we used to think palliative or not, nothing much we can do. We are able to do it. Now, next coming to the thoracic part, chest part. Now here also, because esophagus is such a complicated means major surgery where even lymph node dissection is important, and also preserving the thoracic duct and surrounding structure, lesser damage, early recovery, because we don't do thoracotomy. It's more easy. Even lung surgeries, lobectomy, we are able to do with this, and mediastinal tumors. So many thymomas I have done. So it is more easy. You don't have to cut the sternum and open it and do it. That adds to a lot of morbidity. ICU stay and all that can be avoided with this surgery, robotic surgery. Now coming to the abdomen, similar way, we can say hepatobiliary, pancreatic cancers, stomach, GIT, and more so in the pelvis, I would say rectal cancers. It has made a tremendous difference, a lot of difference in the way we dissect and we preserve the nerves, and how we take the TME plane and complete lymph node dissection has made a lot of difference. And not only that, the pelvic part has got a lot of like gynecological oncology, means what we say is uterine cancer. It can be endometrial cancer or cervical cancer. It's so easy to dissect. As Dr. Kaddu has already told, like bladder and prostate, it has made a tremendous difference. And partial nephrectomy means you name an organ, there is an advantage with the robotic technology, how we dissect it. I could say like anatomy is redefined now, because previously we used to read in the textbook, dissect the cadavers and then do it. Now, because live we are able to see it, and also there is a monitor, and also sometimes we are provided with two monitors where even the student can learn from that. So it is so easy to even teach to the younger generation the future surgical procedure. That is one thing. One more thing is when patient is very obese, majority of these pelvic cancers occur in obese patients, particularly C endometrium and all these things. It is so easy to do it because though cavity is also more and morbidity is associated with this surgery is very less, so they recover very fast. Definitely, ICU stay is minimized. In that way, I think there are a lot of benefits, even including cancer and even otherwise also with this dissection. I would say it has made a lot of difference in patient outcome.
Rightly said, Dr. Rajashekhar. Thank you so much for elaborating that in detail, the type of cancer that can be managed through robotic surgeries. And um, yeah, so moving on to Dr. Deepak, sir, you have discussed about the insurance coverage in robotics surgeries. So, what are the factors that influence insurance coverage and reimbursement for robotic surgeries? And are there any challenges or barriers that patient or physician face when seeking insurance clearance for robotic assisted procedures?
So I would like to give a wide perspective about how means the major hurdle for surgeon going for a robotic surgery is the whether patient is affording that robotic surgery or not. Because many times if he is having the insurance coverage, even that insurance coverage is not covering the robotic charges. But now we are slowly moving that most of our health insurance companies are trying to cover. So the major hurdle in going for a robotic surgery, not from the surgical or technical point of view, but the finance point of view, is the major thing is whether the cost difference between the laparoscopy and open to the robotic, how much is the cost difference. So I would like to put it like this, like if in general what general laparoscopic surgeries we do in urology, it costs around 2.4 for a general ward. So it goes to around 3.2 to 3.4 in robotics. So it's just 1 lakh extra. So if the patient is not insurance covered, he want to pay in cash. So we can tell the patient just you have to pay one 20 to 30% amount extra, but you will get the best results. And if the patient want the best results, he will definitely go for the robotic surgery rather than going the laparoscopic surgery followed by some complication and re-exploration. So this is one thing. And the second thing, the insurance companies. So there are many insurance companies which are giving complete coverage about the robotic surgeries, like Religare is there, then Aditya Birla is there, Cigna by Manipal. The most prevalent company, that Star Health Insurance, they are still in, they are not giving the complete coverage for the health insurance, but the robotic companies and the healthcare system is in talk with the Star Health, which covers around 20 to 30% of the health insurances. So they give the partial amount of insurance coverage. They don't give the complete. So, but and this the other New India Assurance and the other companies, these are also give the they give the partial coverage of the robotic surgery insurance coverage. But the healthcare system and the robotic companies are also in talk with them, so they are also moving forward to give the complete insurance coverage. So I would like to put like more and more our health system is now at they are mostly cash driven, or the patient is paying by this scheme like MJPJY or the Vajpayee schemes. But as the affordability of the general patients of the India, it goes up, and as more and more patients are getting the health insurances for their health coverage, so and the health insurance companies are covering the robotic charges, the robot will spread like anything. It will be rampantly spreading robotic, like as Rajashekhar Jaka sold, every nursing will home will have a robot. And as Sumit Talwar said, we having a laparoscopy in each and every operation theater as of now, we will be having after some it's just matter of 15 to 20 years time, we will having the robot coverage everywhere. So I would like to put in some other perspective, like if you want to go from Mumbai to Delhi, and we used to choose train before the aeroplanes were not that much, because the cost was like 10,000 for one ticket. Now it has gone to 3,000. So more and more companies of robotic are entering in the system, so that cost is also going down. So the robot we purchased by the Manipal, which was for 17 cr, we purchased it for 8 cr or 10 cr. So the costs are drastically coming down. So once the cost of maintenance of the robot comes down, so the providing that robotic service to the patient becomes more affordable. So those are the things, like more and more robotic companies coming in, more and more insurance company accepting the robotic surgery coverage, and the patients of India become more health insurance dependent for their health coverage. I think the time is not less for the that most of the surgeries which are minimal invasive will be happening by most of the time robotic way in India, as it is going on now in USA. So that's the thing for insurance coverage about the robotic. So yeah, that's it.
Thank you so much, Dr. Deepa. I think you have rightly mentioned that more than 50% of population in India are not even insured. So I think first they need to get the insurance done, and then the insurance company will think about the type of surgeries that should be included, and then how the multiple stakeholders at some point matches one criteria for any type of surgeries for that matter. Robotics is the new and the latest development, so I think
So I would like to
passing.
put one point, that sometimes the insurance companies reject, saying that we are not covering this because your this surgery, you specify the reason. So the surgeon has to be very confident and give in writing that this surgery can be best performed by the robot. And even there are other options like laparoscopy or open. I would like to go by robot. You have to mention the reason. So the companies sometimes try to push you behind so that the robotic surgery is not done. But if you give a confident answer and if you really want to go for robot, the companies will finally accept. The insurance companies will finally accept. So sometimes you have to give a that letter for why you want to do this surgery if you want the insurance clearance to be done. So that's it. Yeah.
Rightly said, Dr. Deepak. And what challenges? So the second part of my question was, what challenges does physician face when talking about robotic surgeries and insurance coverage?
So yeah, to so robotic surgery is definitely costlier than open and laparoscopic. So as I told, it's just 20 to 30% more than the laparoscopy if you want to try to explain to the patient in that way. So if the patient is affording, you can definitely go for robotic surgery. So these are the difficulties we face. The most important thing is finance, explaining the patient how robotic will be easier to perform. But for some surgeries like robotic radical prostatectomy and sometimes partial nephrectomies, there is no other way but to go for a robotic surgery, because if you try doing it laparoscopy, it will be, and it can land up in problem, like outcome for the patients, or even completion of the surgery, or complications happening during the surgery if you don't go by a robot for these surgeries like radical prostatectomy. So the explaining the patient is a hurdle, and then after sending for the insurance clearance, we have to give explanations. Sometimes we have to use less arms of the robot, because one arm would cost some 10 to 15,000 for each additional extra use of arm. So we have to compromise sometimes on the arms. We have to reuse our robotic drapes, so which are now they are making it like you can sterilize and use it. Previously it was you have to one time use. So, and slowly the companies are also decreasing the cost of robotic arms, and their way of providing to the like Manipal hospital or other hospitals, how they ensure that coverage of those arms and the maintenance cost. So as it goes down with wider and wider spread of the robots, and with the other companies coming in, it will definitely become affordable to most of the population in India.
Rightly said, Dr. Deepak. And moving on to Dr. Sumit Talwar, sir, can you discuss some procedures and examples within general surgery where robotic assisted techniques have shown significant benefits over the traditional lab? Uh, Previously, we used to say open as traditional. Now we are saying traditional in lab surgeries as well. So, can you give an examples of the type of procedures in general surgery where robotic assisted techniques have shown significant benefits over the traditional lab cases? You're on mute. You're on mute, Dr. Sumit.
Sure, there is no dearth of examples and instances where robotic surgery is actually proving to be better, significantly better than laparoscopic surgery. The first one, as I've already discussed, would be bariatric surgery in patients whose BMI is more than 50, 60, 70. Those patients, if I have to do a laparoscopic surgery, I would probably be very, very upset and very tired and very sore after the surgery. Whereas after the robotic surgery, I am as fresh as a daisy, and I am also, more importantly, more comfortable and more confident that I have done justice to the difficult operation, and I have given the best possible operation to my patient. The other place where the robot would shine in general surgery would be in the management of complex hernias. So there are patients who have been operated multiple times. The hernias have come back again, and one open surgery has been done for the hernia, one laparoscopic surgery has been done, and there is it's a virtual battlefield. So with the robot, there is a new technique which we call as the ETAP, in which we stay in a plane which is between the rectus muscle and the peritoneum, which is incidentally also the ideal place to place a mesh. The In these difficult patients, the robot really comes to my aid in doing the surgery quickly and more precisely and in a better fashion. So complex hernias, recurrent hernias, the ETEP technique is much easier to do with the robot, and the results are going to be superior, definitely. Then the other common surgeries that we do in general surgery are again similar to the rectal cancer that Dr. Jaka does, is something called a rectal prolapse, or we do a surgery called um, the wall prolapse after hysterectomy, in which the vagina just comes down. That vagina has to be fixed back into the abdomen. Similarly, the rectum has to be fixed back in the abdomen. The same challenges, limited space, important structures all around. So it is much better visualized with the robot. I can see much better. It's a 20 times magnification, 3D, high definition vision, and it is almost as if whenever I teach students, the um, first expression that they offer is that it looks as if you are sitting inside the abdomen and operating. That is how good the vision is in robotic surgery. And then the dexterity of the instruments and their movements and possibilities. Sometimes we can do movements in the with robotic instruments which may probably not be possible with our own hands also. So that is the kind of precision, that is the kind of dexterity, that is the kind of vision that we have. The other end of the abdomen is just under the diaphragm, where um, there is an operation that we call Nissen's fundoplication for hiatus hernia. If that we have to do, then gastrectomies for various reasons. If we have to do the anastomosis in the just below the diaphragm with the esophagus, the anastomosis, we don't really depend on any staplers or any mechanical devices. We can sew it by hand, and it probably turns out to be better than what I could have achieved with a stapler. I think that basically sums up all the difficult ones. The easier ones like colon surgeries, colonic resection, small bowel resections, they can also be very well done with the robot. Now with the advent of robotic staplers, it has become even one more degree better, and I can control everything from my console, and it is going to be more precise and more accurate, and therefore much safer for the patient. My outcomes are going to be better. Thank you.
Thank you so much, Dr. Talwar, for shining light on all the procedures that can be done through robotic surgeries. We have talked about the GI procedures, urology, cancer, and different types that the robotics are currently targeting the surgeries for. Moving on to the ongoing and the future emerging trends in robotics. So, Dr. Manjunath, are there any ongoing research or emerging trends in robotics that have the potential to further expand its utility in minimally invasive procedures?
Oh yeah, definitely. I mean, right now, at least we are just looking at the tip of the iceberg. In fact, so if you really look at what robotics covers, if I were to summarize, there are three things. One is the vision. Another one is the precision with which we can do the surgery, and the dexterity with which we can do long surgery, so that the surgeon is really comfortable. So these are the main advantages of the robotics at this current in time. Now, when you look at the robotics, you have to look at a very bigger picture. What are the adjuncts that we can use with the robotics? Those are going to be what we call as a firefly technology, which is already there, where we can see the bile duct, or we can see the blood vessel so clearly that we can minimize as much blood loss to the patient as possible. Now, there are more augmented reality that is actually coming into the robotics as well. This is what we call as a computer generated augmented reality. It depends on the AI. So we now have models that are actually being learned about different types of procedures, where the robot will be showing you the map, a roadmap of which is the best way to get this procedure done. So this is where the AI technology comes into picture. There is another thing called as what we call as smart, or what we call as a guided robotic technology, that is still in the labs at this moment. And there was a new article that had come up very recently, where a robot was able to suture a pig skin 87% of the time much better than a human being. I mean, being a GI surgeon, I mean, for me, that is news. That is great news, because I don't need to take the burden of even suturing through a robot. I would just need to say, hey, you start from one end to this end, and show the robot the end to end, and it will just do its work. So if you're really looking at augmentation, these are the augmentations that we have right now. Now there is the first robot that is actually has come into the clinical practice is usually the name called Da Vinci robot, and that exists as a newer technology or a newer platform, where it is a single site platform. Now we are talking about small little incisions all over the body. And now there is a 5-year accumulated data that actually the single site platform is actually a little bit more added advantage, which is a cosmetic advantage, where there is going to be scarless. Basically, you have all the three fingers or the two fingers all the way going into one single aperture, which is the incision in the abdomen, and they spread out inside the abdomen like fingers of an octopus, and helps in performing the surgery. Now, this is another innovation that is actually in works right now, and people are starting to use this technology as well. And one of the most important thing, which I think all the surgeons would like to have, is what we call as sensors, what we call as haptic movements or haptic feedbacks. Now, this is something that is very lacking in the robotic technology at this moment in time. And if that comes back, it will just mimic our own hands. So we'll go back to one full circle, which is open surgery. So basically, getting the feel of the tissues and the feedback from the tissues as you're handling them is something that we don't have at this time, because we are just touching them with the instruments. But when we have those feedbacks at the time, the data actually shows that the tissues are much more softer and gently handled because of those feedbacks. Now, these are the emerging technologies that are there right now in the field of robotics. I mean, one important thing that I would like to remind everybody about the robotic technology is, see, robotic is just in its initial stages. It had taken almost a decade. Any technology, especially a newer technology, almost takes around 5 to 10 years for it to make its mark. And the robot has actually made its mark. I mean, the part of showing that it is important in the healthcare, it's already there. Now, there are a lot of other areas which we don't even know at this moment in time, and we have not even talked about. Apart from the surgical aspect, the robot has penetrated. Now we have the huge language model which actually incorporates the AI technology. Imagine that AI technology being fed into all the different types of surgeries that can be done, and the robot will give you the precision with which, you know what, for this surgery, this is the roadmap, this is the shortest way, this is the quickest way, and this is the safest way you can do the surgery. And that is augmented reality. I mean, I was blown away by the new augmented reality that Apple presented almost 2 or 3 days ago, which everybody were talking about it, but now it has become a reality. I'm pretty much sure in the near future we will be looking at what we call as autonomous robot, where the robot will be guided by a surgeon, and the robot will lay out the map, and you will say, you know what, this is the way it's supposed to be done, and you would say, yes, let's start doing this way, and you would guide the robot in if it makes mistakes. So for me, the basic understanding and the basic enjoyment about the robotic surgeries are that it was able to sew a pig's intestine 87% of the times, and that accuracy is far better than the accuracy of a human person who's actually trained to do surgery for 5 years, and that is proven. So that is how we are moving so forward, so quickly forward in terms of getting newer refinements into the robotic surgery and adjuncts to the robotic surgery itself. It is a pretty exciting field, and if you were a business person, you would really look at this as a really growing venture. In fact, the annual rate at which this is being grown and that this field is growing, it is probably around double digits. I mean, there is no other field that you would look at that is growing at this faster rate in a double digit. I mean, and that is where the robotics is at this time. We have a lot of startups that are involved in bringing up newer technologies, newer robots in the market. Initially, when it was started, it was just one. Now we have almost five, which is actually functional. And there are pretty good startups even in India as well that have started off with a robotic. And with all these newer technologies and new people, and all, what really makes it more affordable and makes it much more better. And this is what I think is something really exciting about robotics. Even though it is a newer technology, we should start embracing it. And the embracing this technology will only come when the patients come forward, when the patients talk to their own insurance company and say, why are you not covering this? This is no more a research technology. Robotic technology is not a research technology right now. So they should tell the insurance company and accept, saying that, you know what, you have to include this as a proper laparoscopic surgery or a minimally invasive advanced surgery. And that is where it is. When more patients get in, more operations are being done, more advances are being made, and the price comes down. Once the price comes down, it becomes much more cheaper and more advanced. You may have a small handheld robot at one point in time, they may have a handheld mobile device. We never know. I mean, the future is very bright, especially for robotics in the healthcare system as a whole. Because right now, if I were to just pinpoint, apart from surgery, there are so many places that the AI technology can come into picture and start making decisions for us which we don't want to waste our time in. And those decisions just can be made very quickly based on the AI algorithms that are there, and patient can just get better. Because 80% of the time, all the decision processes that are made, especially in a healthcare system, which are non-procedure based, are actually could be made into an algorithm, and that can take the mundane effort of your time away and put your time in a much more better way in trying to get the patient in a better outcome. So I think robotics is doing that in the field of surgery right now. It has made its mark. It is definitely the future, as what Dr. Jaka has pointed out. And definitely, I would say it is going to last long. And definitely it is going to be as common as what Dr. Sumit Talwar has pointed out, that it's going to be there in every smaller hospitals that you can find. And I hope to see that day that where everything can be done with the robotic technology as we move forward.
Thank you so much, Dr. Manjunath. I think you have very rightly shed the light on the astonishing trends that are foregoing into the robotics field, and talking about the technology that they are using and laying the roadmap and everything. So I think it holds a very great future into the healthcare in the coming future. So with this, I would like to end this discussion here today. I would like to thank all the esteemed panelists for taking time for this critical panel discussion. And this discussion has been very informative and has provided very valuable insight into the robotics. Into the integration of robotics into the healthcare system. So, thank you so much. Thank you.
Thank
Thank you,
you.
Dr.
Thank
Thank you very much.
Thank you, Ritika.